The doctoring program is basically a practice run in learning how to be a doctor, starting from going in and seeing a patient to writing your notes and talking with other doctors and attendings.
Doctoring is one of the best programs we have at our school. It really gives us the opportunity to practice actually what it feels like to be a physician and be a doctor and interact with patients. And so we have the opportunity to have standardized patients who are actors come in, and we kind of do our whole history and physical exam just as you would in a regular clinic, and it's a great experience.
Doctoring is a really complicated program where you get exposure to how things run in a clinical setting, learning how to do physical exam skills, interview patients, take a detailed history, and practice presenting to physicians as you will in the real world.
I really enjoy the fact that we're given a safe space to make mistakes before we have real patients. Not that our standardized patients aren't real patients, but it's a time to make mistakes and to mess up on little things or stumble on your wording and get feedback on that before the pressure is really on us with patients in real clinics.
Being able to practice in a safe, controlled setting kind of helps you boost your confidence, practice your skills without having to cause any major problems to a patient. So let's say I'm practicing a physical exam, it's way easier to do it in a controlled setting where you get feedback from faculty, you get feedback from the standardized patient. So with that information, you can kind of tweak how you do your physical exam to better improve patient outcomes. So we currently rotate in family medicine clinics throughout Arizona.
I'm Dr. Maricela Moffett, actually founding faculty here at the university, and I direct the doctoring program. In doctoring, we teach our students how to be doctors. So you think about the skill set that is necessary. And probably the most important one is actually communication. It's a one-on-one type of training. So a video is obtained during what we call an SP encounter, where a standardized patient is SP, will be trained in a case, and then they'll play the case, and then following that history portion and then a physical exam, the student will receive feedback both from a faculty member as well as from the standardized patient.
Overall, doctoring program is a great asset that has been the most enjoyable part of my medical school, I could say.
When you come into doctoring and you see a patient that has a complaint of something that we've been talking about in our other courses, it really ties it all together, and it really brings it home of this is what we're doing and this is why we're spending so much time learning what we're learning.